So keloids. In this particular presentation, we're going to talk about keloids and what they are and how they can get removed, because they can actually get removed by using electrical arcing. We have made a lot of information available about keloids. The main reason is that they've been confused a number of times by supposedly very experienced aesthetic practitioners, and they're quite easily recognized. And we're going to jump into that right now. So how are keloids formed? They're normally formed due to skin injuries and deep wounds and surgery. So some people are more prone to get keloids, other people aren't. It really depends on if you have that that propension to form keloids. So if you get, say for example, a wound, you can get a keloidal formation even if you haven't had any infection and so on. And that can actually happen. Normally if you have a superficial wound, what happens is you can get a scar if there is infections, but in case of keloids, even normal acne, minor burns, chicken pox can actually, including skin tightening, on people who are prone to keloids, can actually get them. So basically, a keloid is something that forms wherever there's a damage onto the dermis on people who have the propensity of the predisposition of developing keloids, and there's nothing you can do about that, unfortunately. So if they have that predisposition, that's really it. This is an example of an atrophic scar. The reason why it is easily recognized as an atrophic scar is that if you look at this, the color, it's quite pinkish, is a very fresh scar, and it is still within the border of the of its injury, so it's very recognizable as a hypertrophic scar. Very likely this red part here is going to decrease in size over time, so it's not going to be as visible as it is in a number of months. So this is a very important thing. So another example of a recently formed a hypertrophic scar, once again I do apologize. Again, this is because it's actually contained within the borders of the original injury, and the color is vivid red. So we'll see very shortly what happens to keloids and how different they are. And also, you wouldn't actually want to treat this sort of hypertrophic scar at the moment because it's still in development phase, so it's going to reduce in size. So you don't want to touch it. You just want to wait until it's time to remove it, to actually give it a few months so the area is not as pink anymore, and then you can actually go off and do laser leveling off. You can actually ablate it from the top later on by using arcing or electrical plasma, whatever you'd like to do. So often keloids can be mistaken as hypertrophic scars and vice versa. This is why we made this information available to start with. Hypertrophic scars stop as the area heals, but in case of keloids, they actually grow. They keep growing and growing after months. So if you have a hypertrophic scar, what you'll find is that over time it will actually subside slightly, if not completely, many times. In case of keloids, they actually keep growing and they go over the border of the original injury, skin injury. Keloids migrate into the surrounding areas. They actually bulge out of the original problem with the original wound. Look at this. This is a classic keloidal formation This is like in the middle, we've got in the left and middle, we've got cerebriform keloidal formation. On the right is just the classic earlobe keloidal formation. And if normally they're actually quite frequent in skin type 4, 5, and 6. And you'll usually find them in the ear because there's ear piercing in there. So a slight infection and so on, they can actually trigger them, and then they are so unsightly that you want to have them removed. But really, keloids are not there as a medical condition because you can keep them. Not going to cause any problem to anyone. They're just very unsightly. That's all they are. This is another keloidal formation after a tattooing treatment. Again, it's so recognizable because you actually see us bulging out completely from where the area was. So if you compare this to the, say for example this, obviously the difference is very noticeable. So even tattooing can actually cause it. This is open heart surgery, and you see that wherever you've got the suture points, you get keloidal formation, and this is a quite clear keloidal formation because they actually bulge out from where the suture points were. So if we wear normal scars, then it would actually be that bulging. That is a very clear sign. This sort of thing is not a normal scar. It's just far too bulging for that. Now, the removal of keloidal formation can be challenging. The problem is that they do tend to grow back. That is the problem. And so you actually chop them off, and they can actually expand even more. That is the problem with that, with keloidal formation. Whereas, say for example, if you're treating a hypertrophic scar, you don't really need to care as much. You only need to level it off, and then it's very likely that you're going to get a very good result. You can level it off using even a scalpel, or you can use electrical arc, and you can level it off using a laser, whatever you like, really, almost. But basically, you know that a scar, a hypertrophic scar, is not going to grow back. Normally, they're treated with cortisone injections. And sometimes with radiotherapy, which we don't actually suggest, in order to prevent the regrowth. And sometimes, as we see, cortisone injections in order to actually shrink them. Now, this is a keloidal formation on skin type 1, which is quite rare to find, but still they can occur. This is surgery in order to actually remove the keloidal formation. And again, what you want to do is just chop it off using surgery at times, or if you're good at it, you can actually do a better job by using electrical arc in most keloids anyway, and then doing some cortisone injections during healing or something of the sort in order to prevent the regrowth. Or what you can do is just do their injection, the cortisone injections, and then wait a few days in order to perform the surgery, or just do cortisone injections, and that's it. Again, for cortisone injections, make sure it's done by a doctor, because cortisone is a medicine, so is a drug. Use of injectable steroids like cortisone, so that is the classical way in order to remove and shrink keloidal formation, is just by using injectable steroids in the keloidal formation. Cortisone injections or steroids are administered every 6 weeks or 4 weeks interval. It really depends. I'm going to show you some pictures on how good they are, the sort of treatments. And the skin does not require to undergo any traumatic events which could trigger a keloidal regrowth or enlargement. So that's another important thing. But basically, some people also couple laser treatment with the sort of injection, cortisone, steroid injections. So you basically get cortisone in there, bang, you inject it until blanch. This just is another picture of the treatment. Also of the cortisonal treatment. And in case of intra-lesion steroid injections are not effective, not always, steroids are not always very effective, because also another thing with the steroids is that with cortisone injections is that you have to sometimes undergo a number of injections in order to shrink them to an acceptable level, and that can be a bit frustrating. Whereas if you just combine the ablative treatments with cortisonal injections in order to prevent regrowth, you may get good results. When we say good results, is that you don't actually get the regrowth after the treatment. Basically, when you use cortisone in order to cortisone injections soon after the laser treatment or voltaic arcane treatment in order to prevent that regrowth. That's quite important. And also you can even use radiation therapy, but it's a bit of an overkill. But still, is something that people do. This is what you would actually want to see after a cortisonal injection treatment. You want to see the keloids shrink in this fashion, as if it is actually been eaten from inside and slowly disappear. And again, this is another example of keloidal removal over time. And also another thing that it can be done with keloidal formation in order to remove them is by occlusion. There are a number of studies that support that, but also the problem with occlusion is that is particularly that, see whether there's another slide that's not there, but we'll actually finish with that. The problem with occlusion is that, I mean, really you need to occlude this area where the keloid is for several hours a day and for several weeks, and people are not very consistent at that. There's been studies which suggest that just occlusion with vitamin E, so you apply vitamin E on the keloidal formation and you then apply occlusion, then it's going to speed up the keloidal removal quite a lot. But again, is a treatment that requires time and patience. It actually is proven clinically to be effective, but from a practical point of view, people are not very keen to actually go through with it because they can forget. You don't want to do it every day. Very few people are as well disciplined to actually do it for several hours a day, every day, up until the keloidal formation is completely gone. So that is it for this particular presentation. We're going to go back to our chat here. See whether I can actually start it here. See whether I stop sharing. Okay, beautiful. Any question? So we've got a question here from the chat I just spotted. Now, how much does your device cost? Well, our device cost is 3,000 GBP, British pounds plus VAT. And does plasma works at keloids? Yes, it does. Basically, keloidal removal is done in a similar fashion as any laser and so on. So basically, whenever you're removing keloids, you want to actually ablate them. You can ablate them by using a scalpel, using ablative lasers like CO2 lasers, for instance, and you can ablate them also by using electrical arcing or plasma, by ablating them from the top. So that's another effective way of doing it. But remember that if they're quite big, then you may want to consider a very powerful plasma device in order to ablate it as quickly as possible. And there's no guarantee. There's no guarantee that it's not going to grow back. There's been several reports and claims that after using electrical arcing hasn't grown back. They have not grown back. However, there's no guarantee that they're not going to grow back again. So they can grow back. That is the point. But in order to prevent that, the keloidal formation to grow back from growing back, then you want to perhaps try some steroids injections. What you can do in a first instance is just actually ablating them, and then if they don't grow back, all well. We've actually seen a number of people going through laser treatment just by ablating the top of the keloid, and there hasn't been reports of them growing back. And again, there's been several reports of which are not verified by us yet, of people burning off the keloidal formation, and no reports of the keloidal formation from growing back. But again, there's no guarantee that they're not going to grow back. They can grow back. Then I just read another question here on the chat box. Is your device ready to purchase? Yes, indeed. We've got the Beauty Tech at the moment. It's in £3,000 GBP, okay, GBP, pound sterling, 3,000 GBP plus VAT. It's no euros, GBP, okay. Any other questions? So going back to the questions, we've got the other question is the new device ready? The new device is not ready. It's been designed already. We are adding extra features, so not at the moment. It's not ready. Then we've got the other question, and once again, please use your voice if you wish to ask any other question. You can also put it on here in the chat box. Is the new device going to be called Beauty Tech? Very likely not. We still have to decide on the name of the new device. The new device you spoke about in the latest videos in all the languages, yes. Then estimated ETA. What do you mean by ETA, Christine? (2019) next year, rollout. Yes, 2019 is going to be ready in the market, for the market in 2019. Any other question? If not, we're gonna end this this session. I'm gonna see you next month. Okay. Yes, it can be. As a skin tightening treatment, yes, it can be. We haven't actually tried it, but we've seen several companies doing it and claiming of good results. So, yes, so basically, yes, we can certainly be used on the forehead to attenuate the wrinkles on the forehead. Yes, indeed. Any other questions? So if no other questions, we thank you very much for being here today, and these sessions are going to be available on willtakeplasma.com for further viewings if you want to view them again, and there's going to be some online tests on this particular event. So thank you very much for taking part, and we'll see you at the next session.